This is big here. The CDC declaring racism a public health threat. On the agency's website, its director, Dr. Rochelle Walensky, with a powerful commentary saying the pandemic highlights generations of the negative impacts of racism on public health. Joe Ripley joining us live from Midtown right now. And Joe, how does the CDC, how are they working to address this issue here?
Well, first, Sheba, they have acknowledged it, the CDC, saying that they are encouraging public discussion of racism in public health through a new online portal they've set up. The CDC also promising to send COVID-19 funds and to make investments in healthcare infrastructure for minority communities, as well as expand internal efforts to become a more diverse agency. CDC Director Dr. Rochelle Walensky wrote the agency is studying how race impacts an individual's health, stating, quote, "Over generations, these structural inequities have resulted in stark racial and ethnic health disparities that are severe, far-reaching, and unacceptable. As the nation's leading public health agency, CDC has a critical role to play to address the impact of racism on public health."
If it's in chronic diseases, if it's in infectious diseases, if it's in environmental issues, they all impact people of color disproportionately.
You heard there from Carlton Duncan, former COO of the CDC. He's urged the CDC in the past to acknowledge racism as a public health threat and to take action against it. Sheba.
And Joe, there's a lot of work being done at the local level to address inequities in racism and health. Who exactly is keeping track of all of that?
Well, the group, the American Public Health Association, is trying to keep track of all of the local entities and health boards that have declared racism as a public health threat, emergency, or crisis. So far, they've tracked 200 cases nearly, including the DeKalb County Board of Commissioners.
All right, Joe Ripley, thank you.